In this series of videos, I'm going to be focusing on cancer pain and our present understanding as well as the treatment approaches for this, including integrative approaches. Firstly, we will be looking at the overall introduction, the commonality of cancer pain, and why we should be doing so much more to help our patients manage this extremely common complication of cancer. Now, as many of you are aware, cancer in itself is extremely common. We are estimating that almost 3.45 million Europeans are getting diagnosed with cancer. In the UK itself, the data is that approximately 390,000 people get diagnosed with a cancer every year. That means an average of 90 seconds, one person somewhere in the UK is getting a diagnosis of cancer. Coming next to cancer pain in itself, while cancer itself is this prevalent, actually people do not realize that cancer pain itself is a very common complication. Indeed, cancer pain is often the most common problem at diagnosis itself. Why is that? First of all, pain is often the most common presentation with any symptom before you get a diagnosis. And this kind of pain then is quite complex in terms of the number of areas and the reasons it can come from. And so that's main purpose. There are 3 C's of cancer pain. First of all, it is actually quite common. Second, it's actually quite costly to treat. And thirdly, the reasons that make it so costly to treat are because it's quite complex to get precise cause and effect. What do I mean by that? First of all, how common is cancer pain? Now, of all the studies that have been done and various cancers have been looked at, there are some cancers in which the pain is extremely common. So for example, with pancreatic cancer, you have almost 44%, almost half the population with pancreatic cancer will have pain. Another group of patients is head and neck cancer patients. It is estimated that up to 40% of patients will have pain due to the cancer type itself. But beyond that, overall, when you look at it, cancer pain can happen in up to a third. So 33% of patients, after they've had curative treatment for cancer, will be left with cancer pain. There's another group of people where it goes. So while they're having treatment, while they're having any form of anti-cancer treatment, it is estimated that 59% will experience pain due to the cancer treatment itself. And once you've gone into sort of the palliative or terminal end stage cancer, it is estimated that almost 78% of people will experience pain. And indeed, there is a rule of thirds. 1/3 of patients will have pain usually in one area. 1/3 of patients with cancer will have pain in 2 areas. And 1/3 of the patients will have pain in multiple areas of the body. And so you can see that this automatically makes it a very common problem, but a poorly understood problem. It's quite costly to treat as well. We've got some data from the US that suggests that up to 76% of patients will be going for one kind of pain-related treatment that is going to cost them. What that effectively means is, on an average, there is $890 per month will be the cost on trying to manage chronic pain due to cancer in these patients. And finally, the complexity part. What do I mean by complexity? Well, the problem is you can have cancer pain due to multiple reasons. Firstly, of course, you've got the cancer-related invasion. So the tumor-related invasion of various structures can be one reason for pain. The other common reason is actually the surgery that is done often for cancer pain can leave people with a form of cancer-related pain. The third, of course, is the treatments that are given other than surgery. So immunotherapy, chemotherapy, radiotherapy, all of these treatments themselves can cause secondary side effects that can cause cancer pain. And last, of course, but is not fully appreciated, is the emotional load, the cognitive load, and what sometimes we refer to as the spiritual component that can also be contributing to the pain. All of these can be mixed with each other, and this is something that makes pain often very complex and challenging to treat in the context of cancer. And of course, there are some barriers as well. First of all, as I said, the biggest barrier is sometimes the lack of knowledge of this complexity among the healthcare professionals themselves. The second is, of course, a lot of the healthcare professionals, for example, the oncologists, would be so invested in providing the necessary oncology-based chemotherapy or radiotherapy or other forms of treatments that pain is often ignored or just accepted as something that must be endured because that's just the way the treatment works. But that in itself is a barrier because there is no attempt done to actually support or help patients manage that. This then also feeds into the second barrier, wherein patients themselves have these beliefs about various drugs that are used for managing the cancer pain. Because of the side effect profile, because of the stigma associated with some of the drugs, that then the pain is not managed, not recognized, and not controlled well. And of course, the third barrier is the system barrier. We just don't have sometimes the systems in place to provide the right kind of cancer pain treatment and advice and support to help the patients quickly. It's not accessible often in primary care or in secondary care, and that lack of communication between various providers is a system barrier as well that makes it difficult and complex to address cancer pain. I hope you found this information useful with regards to the introduction to cancer pain, how common it is, how costly it is, but how complex it is. In the next video, we'll look at the presently understood sort of causes and the mechanisms for cancer pain. Thank you for listening, and I'll see you in the next video. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.